In-house James Bocox, Chief Pharmacy Officer, Southern Sky Brands. James, good morning to you, sir. How are you?
I am doing great, Paul. How are you this morning?
Man, you kind of did a number on us here because I thought we were going to get you in as far as pharmacy is concerned, and now with this new job. Congratulations, first of all. I know it's something that you're perfectly fitted for, and
I
looking
appreciate
forward
it.
to it.
It's actually an addition, Paul. So
you're still going to be the executive director?
I am, yes, sir.
Okay, so you can do those. Okay.
I'm not here in that capacity this morning, but yeah, still doing both. Just was excited. Actually, the guys Justin Mafus and Steve Merritt from Southern Sky. Mm-hmm. If you remember last year when I was on here and we were hoping to get pharmacists involved, then we were pushing through the legislative means to get us involved to help with things. And I had been speaking with them, and they were on board the whole time. And so then it passed. They left the pharmacist out. I believe it was said that we just cost too much money to be effective, and in this business they just couldn't afford to pay for a pharmacist. And so, talking with Justin and Steve, and they said, hey, we are having a true medical cannabis program here at Southern Sky. We believe that there's value from a pharmacist. We believe you're the medication experts. And for the program we're wanting, whether it's legislated or not, we want a pharmacist to be with us. And so for a while, it's a little bit of a consulting role, just trying to make sure that we're going to set up a program similar to what Arkansas does with a toll-free number. So anytime the dispensaries are open, you're going to have access to a pharmacist. If you have any questions whatsoever, it can be anonymous. Just tell us what medications you're on. Tell us what kind of cannabis you're taking, whether it's inhaled, whether it's a gummy, and we're just going to walk you through the process. And then I think one of the biggest things that a pharmacist brings to this whole situation is fighting through the stigma. There's a place for medical cannabis, and fighting through that stigma of the elderly who came through the 60s and just don't want to have anything to do with it when they could benefit from it. So I'm really looking forward to it.
Well, and we've been doing this for a long time as far as the narrative on introducing medical marijuana in the state of Mississippi and all through the initiative process. And I think all through that, I was just incredulous to figure that why in the world would not the pharmacists be part of this? Because if it is a true medical marijuana program, you need their guidance on this one way or the other. One of the reasons I wanted to have you in this morning as we get closer and closer to seeing the bricks and mortars out there of this is when you look at other states who have medical marijuana, has pharmacy changed? Has the way that they've conducted business changed? Has it been easier on them or tougher? Or what's it due to other states that now have a long paper trail having medical marijuana for a while, or recreational for that matter?
Right. Well, I mean, so when you have a pharmacy like in Louisiana, mm-hmm. they have what's called marijuana pharmacies. And so there has to be a pharmacist in there. It's treated more like the traditional pharmacy where you come in, pharmacist is reviewing medical records, keeping up with things. It's going to add, so right now the world of pharmacy is a product-based world. So we make our money by ginning out as many prescriptions as we possibly can, which is not a good model. And anytime you take minutes away from filling those prescriptions, whether it's a pharmacist or a technician, you're cutting in to the bottom line of that pharmacy. And so we're hoping to try to transition on the medical side on prescriptions to where we're actually getting paid for our time, not just that product. And so what it does is if you have people who are starting to take medical cannabis and they come in and they're talking to their pharmacist, which is going to talk to them, they're not going to tell them no, but it's going to put another burden on that pharmacy having to go through that. Similar to what happened with the immunizations. You and I talked last time. Pharmacists are always ready to help the public. The role of our profession is public safety. And as soon as we get through this pandemic, pharmacists are stressed. We've been given immunizations on top of filling people's medications. And then as soon as we kind of start coming down the hill of that, the feds start saying, well, we're not going to let pharmacists continue to do this. We're going to back off payment. Like with the immunization, the HRSA money ran out. So now who knows what's going to happen when people want a booster that can't afford it. And so it gets frustrating that it seems like in the world of pharmacy.
Is there a deadline on this one, or is it, in other words, if you go by any pharmacist now, you can still get a free booster shot, but you're saying that at some point they'll have to pay for it?
Right. So there was the HRSA money was covering the dispensing costs for pharmacies for people who didn't have insurance. And so now, and so we would bill it, instead of billing it to their insurance, we could bill it to this HRSA program. And so now we're pretty much a lot of times having to eat the cost of this now. So we're past the deadline. So it gets frustrating that it's going to add time. It's going to take away from the time in the pharmacist again, which is fine. This is what we do. But at some point, we're going to have to get reimbursed for it. I mean, it's just that's just kind of the way it is. So
well, here's why this is kind of different than anything else that, as far as medical marijuana is concerned. And we keep calling it medical marijuana, but it's just marijuana. And how much training did you get as far as in pharmacy school with how these things counteract other drugs? I mean, did you guys go into that? Are they teaching that in pharmacy school?
I didn't. I graduated at Ole Miss Pharmacy back in 2005. And so this is a little ways back. And so we had classes on illicit drugs and possible interactions and things, but we didn't dive into it. But now at the School of Pharmacy, they're actually offering classes more specific to medical marijuana. I am getting certified. There are these states that have had this a good bit longer than we have. The states that it's a part of the legislation. They have set up these. There's an International Society of Cannabis Pharmacists, and they are a part of ASCP, the American Society of Consultant Pharmacists. And they have really put together a good curriculum that is continually updated. I mean, every month there's new information because it's just coming out so fast right now. And so it's going to allow me to really dive into the new information that we found. So I'm excited about being a part of that association. So,
well, even if, and again, we're talking with James Beau Cox, Chief Pharmacy Officer now at Southern Sky Brands, but James, even if they did give you this in 2000 or even 1989, what we have on the market now is totally different.
It is, and you can just call me Beau. And that's another thing that's important about a cannabis program. And so I mentioned going to Ole Miss. At Southern Sky, we're working toward really hoping to form a partnership with the University of Mississippi School of Pharmacy, where the medical marijuana program is located up there. So we're wanting to do more research on patient studies, see how this affects. We're going to do small patient studies, and we want to do internships across the board with them. But and so we need to standardize it. So we've got not only the cultivators, the processors, we've got the labs in Mississippi that are going to give us consistent product, which is very important.
Many other questions. One of them is, what are they studying at Ole Miss as far as how it relates to what is going on now? Are they changing it because they're doing this, the big marijuana study for a long, long time at Ole Miss? All of those years of studying and the exclusivity that they've had, what have we learned from that as far as we go into this marketing of medical marijuana? Anything at all from the physiology, from the dangers, the addictiveness? What have we learned from all of that stuff since Ole Miss has had that for so many years? We'll talk more with Beau. James Beau Cox, Chief Pharmacy Officer, Southern Brands, Southern Sky Brands. EIC back with Beau Cox, Chief Pharmacy Officer, Southern Sky Brands. If the question people have is, if the federal government, for some reason, Beau, relaxed the laws and the violations of marijuana, what would that mean for the pharmacies? Could they begin to use stock those in-house, at least the edibles or something? Would they be able to do that?
Potentially. It just depends on what that pharmacy wanted to do. But right now, it's a Class 1, which is in the same classification as LSD and heroin, versus cocaine, which is a C2. So we could have cocaine in our pharmacies. I don't think many of us do carry cocaine
Wow.
for anything.
Yeah.
It comes in they still use it in surgeries. A lot of rhinoplasties, they'll soak a cotton ball in it, but we don't have those anymore. We don't really dispense it, but if they would move that, the biggest thing would not only be we could potentially carry it, but it would be just the amount of research and studies that it would open up for. It's so
the
difficult.
FDA could do some study on it too, could they not?
They can, but it's going to be very restricted, and it's going to be very hard to get to do these studies on a large scale. And you were talking about what Ole Miss has done, and they have been working on it for decades up there, and we have learned a lot of information from their work up there. But again, they are so restricted by the DEA on what all they can and can't do with the marijuana that they grow up there that it's been hard to get as much information as we would like to. But we definitely have.
Well, yeah, but I think the public also wonders. You've been doing this for a long time. I mean, it's made national news forever. I think there's another place that's allowed to do it now as far as study. But you just wonder, what other than creating some jobs and getting some funding. What have you learned? I mean, now that we have medical marijuana in the state of Mississippi, you think you would bring some of that knowledge to the table, but apparently you have no idea.
Right. No, we are. It's one of those things to where there's a lot in the background that are the building blocks for what is going to allow us to learn a lot more, all the way from cultivation and how to get different levels of THC and CBD. Right. So no, they're doing great work.
So there is some knowledge being passed on to
for
this.
For sure. Okay. You just don't hear about it because we're just using those as building blocks, really.
The other really catastrophic thing here, if I'm an investor and I'm putting millions of dollars into bricks and mortar standalones, knowing that we don't have recreational, if the pharmacies come in, that's a big competitor. And that's kind of a seismic shake there, isn't it not?
I don't think it will be. I think that once it goes recreational, and I think that it probably will in 7-8 years, you're still going to have a dispensary format. And I think that what it's going to boil down to is if you've got these companies that are positioning themselves to show that they're not in this for the quick cash grab, you're going to have people that are in there for that. But the people who are doing it right, several, including myself, of the people at Southern Sky, we have children who have had seizures. And this is not just a cash grab for us. We believe that it is medical. We believe that it has a place as a part of a treatment program for certain people. And we're wanting to develop that. We're wanting to promote that. So,
let me back it up again one more step here. Do doctors actually know much about this in their training as far as the interaction between some medications and marijuana? Because has there been enough study with that?
Right. Well, doctors, pharmacists across the board, a lot of what we know right now is based on the fact that marijuana is metabolized in the liver. So we know how it's metabolized. We know how other prescription drugs are metabolized. And we know that if you take marijuana, is it going to increase the amount of enzymes that break down the other drugs? Is it going to decrease it? So then what does that mean? A big one is warfarin, the blood thinner. There's instances that we've got documented to where it causes the levels of warfarin in your blood to be higher, and so we have bleeding incidences because of people that are on marijuana. But a lot of it is theoretical, based on those liver enzymes. So really excited to see in the future breaking it down to learn a lot more. Like I say, it's every month we're learning more and more, but a lot of these studies are so small that it's hard to extrapolate it to across America.
A little worried about the patient who gets this from a doctor that they've established a relationship with, et cetera, but they haven't told their family doctor or one of their many doctors if it's who they happen to be going to. But they really do need to tell them when they go there, look, I've added marijuana to my medications.
Oh, for sure.
If that's not the doctor. And I'm wondering, in a very conservative state, if a lot of people are going to do that.
Oh, for
and
sure.
If they don't, they're going to cause some problems.
There's no question about that, and that's why I think having this anonymous hotline is huge in Mississippi. I think pharmacists can probably make a bigger impact in Mississippi than most states, because we get this call comes in, we're not tracing it back, and they're telling us this is what I'm on, And I say, well, this is what you need to be careful of. This is a serious interaction. There's some medications that if you take with marijuana, it could increase the amount in your blood 3 or 4 times. And so we really need to have a way for people who are afraid, who don't understand, to talk to a healthcare professional that can walk them through it and say, hey, this is something that you really need to go back and discuss with your doctor. And so, and even just in regular medications, people go to 3 or 4 doctors. And this is something just with the regular prescriptions that makes a pharmacist so important is you've got your general practitioner, you've got all your specialists, and you come to the pharmacy and, you know, you get nervous in a doctor's office. You may forget to tell them something. We've got your profile. We know all the medications that you're on from across the board and running those checks. And another thing that is developing now and will continue to get better is our pharmacy software has started including some interactions with marijuana.
That was my next question there, but it's like heart medication and marijuana. It would seem that those two things need to be balanced pretty evenly somewhere.
And see, another thing that we're starting to learn is there is an increased risk for a heart attack and particular cardiovascular diseases when people take marijuana. The studies that we have right now are kind of across the board as to how much of an increased risk it actually is. But everyone agrees there is a risk of an increase of a heart attack. So we've got to take these things into account as people start taking marijuana.
Yeah. One of the heartstrings that were pulled is talking about kids and epilepsy. And I've often thought, okay, how do you do this? Because nobody knows exactly what amount. Is it mostly, if you're going to give your child this through frustration that nothing else has worked, and I understand that, but is it trial and error? How do you know what?
Well,
how much?
Right. And I mean, and that's a big issue right now. And that's why a medication like Epidiolex that has gone through the process that is FDA approved is a good place to start that has CBD in it that is for 2 particular rare seizures that it's been approved for. But it's tricky. Actually, my wife and I were talking last night about my daughter was born with seizures. She still has nocturnal seizures, so it's not the shaking like my niece had, which if you've ever held a child that is seizing, then
it's heartbreaking.
You don't care if 90% of the people that promote this program are just wanting to get high. If you can help 10% of those kids reduce or eliminate those seizures, I mean, it's worth it a million times over.
Is the ingredients there that is helpful? And you mentioned THC, the CBD. Is it the CBD or the THC as far as the seizures?
Right. So it can be both. We know that CBD, through the Epidiolex studies, helps with seizures. And so it's trying to figure out, because we don't have any FDA-approved THC products. We've got some THC synthetic derivatives. But one thing about Epidiolex, it was the first drug that was concentrated directly from the plant, not a synthetic. And so, it's tricky. I'm not going to give my daughter gummies or anything just because I don't know at this point. Yeah. So it's
I understand. I want to give you the final word here, Beau Cox, as far as Southern Sky is concerned, because my understanding that it's a company that says, all right, we're going to be pharmaceutical based. We're going to work through the pharmacies and work with the pharmacies as a true medical marijuana. We're Happy Farms. Somebody else says, just come by and get some marijuana. You got a card, and we'll leave it there. So I think it's a good concept. A little bit more about Southern Sky Brands and what their status is in our state. Final segment with Beau Cox, who's now Chief Pharmacy Officer for the aforementioned. After this. We return to our final segment here with Beau Cox, Chief Pharmacy Officer, Southern Sky Brands. Beau, just what is the status of Southern Sky Brands now? Where are they in the development stage and getting ready and the timeline?
So I'm sure y'all may have talked about it already this morning, but today is the day for permits for everybody to get licensed, either as a cultivator, a lab, a patient, and so today kind of kicks it off with getting that information put in. But up the facility's located up off 55 across from the Nissan plant. You can kind of see it going up. And so they're getting the outside's completed. They're working on getting the inside completed. It's a really great floor plan that they've got.
How many square feet is it?
Ooh, I don't know. I'd have to talk to to Mafus about that. But we had a little kind of not ribbon cutting, but a little open house kind of a thing. And it's an amazing facility, state-of-the-art ways to grow. And that's another thing. We're learning so much about the best way from lighting, from humidity, everything to be able to grow quality product in a smaller square footage than a lot of other places. And so it's really been amazing. But they're hoping that once they get the permit, the state has 30 days to approve the permit. But they're actually hoping to have product grown and ready by November, early December, ready to send out. So that's kind of the timeline right now of getting that.
Did they develop their own cultivars, their own the species or whatever you want to call it of the brand, or how? They're
going to be bringing in some plants to use as what they call mothers to clone off of those, and so it's going to be kind of testing as they go along. But they're going to be bringing in established strains right now.
Yeah. I don't know how you can, and I hope you can, but I don't know how you can have quality control without being indoors. How do you do that?
Right. I don't either. I think that you're going to have a lot of variation. If people were allowed to do the outdoor grow, you're just going to have a lot of variation. Hopefully we can get you up there once they get it up and going, because it is an amazing facility.
I'd love to see that. The other part of that is because outside you're going to be subjected to, but 95% more insects, and you're going to have to use, I'm not sure if you're going to have to use chemicals or not, but it would seem that chemicals become a part of that.
Right.
And as far as medical marijuana, that's another thing.
Right.
So you may not make it through the testing.
Right. Yeah, and I've got a friend who's a pharmacist, Cliff Osmond. He's going to be opening a lab here in Flowood called Steep Hill, and I'm excited to see what all they're going to be able to do there as far as just what this looks like. They've brought in people from other states that have got experience with this, and just what does it look like, and how do we adjust? And it depends so much on what part of the plant they're pulling samples from, and so it's going to be exciting to see.
Now, as far as your company, that company of Southern Sky Brands, is that just the cultivation, or do they finish the end products as far as?
They're going to have cultivation, processing, and they're going to have a dispensary up there.
Edibles are going to be produced there at that facility?
Right. They're going to have, from start to finish, Southern Sky is going to be able to handle the entire process.
So when are they going to sell it there, or they will be selling it to different vendors?
Both. So the plan is to have our own dispensary, but then we will also ship to other dispensaries who want our product.
I got you. What's the status of hiring right now?
So today, I believe, was also people being able to put in for their work permits. And so there's background checks. There's a lot that they have to do for that. And so right now Southern Sky's brought in a really great team from around the country and here in the state to get things rolling. But from what I understand, they're doing interviews, but no one that's going to be working in the facilities has been hired yet.
Yeah. At this particular time, as far as the cash transaction, you can use your credit card at the store or cash, as far as we know. Do you know if that's true or not? Or?
I would have to get with them on the exacts of where we are, because I think that's still evolving and changing on how cash works, and it's still. I don't want to speak because it
sounds like Donald
changed.
Rumsfeld, but there are so many things we don't know that we know. We don't know, but it is true at this particular time. So
Steve told me that it's kind of like putting an airplane together while we're flying. We're trying to figure it out. Right. We're trying to do it right and figure it out, and it's definitely it's been interesting so far.
As far as the health department, what else do you need from them as far as knowledge or release of information?
They just have to. You give them the permit, and they have to review it and make sure everything lines up with the legislation that was passed, and then they decide to issue a permit or not.
Good info, sir. Appreciate it very, very much. Appreciate the visit.
Yeah, thanks,
Beau
Paul.
Cox. Beau is the Chief Pharmacy Officer for Southern Sky Brands. By the way, if you want to go to their Twitter site, it is at Southern Sky MS. What's the website, sir? Same thing?
SouthernSkyBrands.com, I believe.
You got it. Thank you, man. Appreciate it very much.
Thanks, Paul.